When you're dealing with geriatric patients, their healthcare status can change very quickly, and you have to be right on top of it to be able to catch those changes fast enough, and when you're not properly staffed, you can't.
We are here to announce that there is a crisis in our hospitals in Arizona.
Registered nurses in Arizona and across the nation are rallying behind the Patient Protection Act, designed to increase RN to patient ratios in hospitals to optimize care. The Arizona Patient Protection Act mandates minimum RN to patient ratios to ensure safe staffing, protects RNs who speak out on behalf of their patients, and provides legal recognition of RNs as patient advocates. We asked seniors at the Devonshire Senior Center and the surrounding Phoenix area to weigh in on health care and on this important legislation.
Nurses really do the job. They're the ones that are looking at you daily, administering the medicine. The doctors, they're good, but they only come in there maybe once a day or every other day. And they usually ask the nurses what's going on anyway.
If you're very ill, you have to have someone go to the hospital with you and stay with you the whole time, because they seem to be so understaffed that if you need help, you can't get it. We're one of the most poorly staffed of any state in the union.
I was sick and went to the doctor late morning, and he said I had to go to the emergency room. I got to the emergency just a little before noon. I didn't get out of emergency until after midnight. They sent me home. 36 hours later, I was back for the same thing.
We need to have registered nurses that will back us up no matter what the insurances say and give us what we need. I would like to know that if something happens to one of us, that will be enough nurses.
The nurse should stand up for herself and say, hey, you forgot that. Now, if somebody might have said that when I was on the operating table and taking those sponges out, I would not have suffered like I did for months on end. I think it's good for the RNs to speak up and say, hey, wait, let's do it right.
It's important that the seniors in my community and all around the state really get behind this Patient Protection Act, because we're the ones with the most to lose, and we have the time to do it.
Find out more about the Arizona Patient Protection Act and other national safe staffing legislation from the National Nurses Organizing Committee at www.nnoc.net.
I support safe staffing ratios because the people I take care of are like family, and if it was my family, this is how I'd want it to be.